I just mentioned to you the galaxy of people who are coming for WCC PCI, and they are giving their viewpoints, what they should do to create a healthy heart and a healthy environment, which is the theme of World Heart Federation this year on the occasion of World Heart Day. First of all, I'd like to ask Sumita Choudhary. She is coming all the way from Houston, Texas, and this is her second visit to WCC PCI.
That's right.
I would like to ask you, Smita, what is your impression about the conference, number one? And number two, what do you think as a policymaker or as an advocate of a healthy heart in women, what you would like to contribute? How would you like to have an alliance with an organization like ours to create a global impact? Smita.
Well, the honor is actually mine to come here. I had such a good experience last year that I had to come back. And I think the energy that I find here at the Congress is amazing. And it is something that can basically contribute to world health and especially health of women. And heart disease is a big problem in women. And the statistics are staggering. We have one woman dying every minute of heart attack or heart disease. And these statistics are latest from the American Heart Association. And the problem is our society has this myth that it's only the male that is going to die. And that's why you see in the movies, they will classically show a male actor clenching his chest and falling to the ground. And this sort of experience creates a lasting impression on people's mind that it's not the woman that's going to get a heart attack. It's always the man. But the truth is something totally different. It's usually a woman who's more likely to die, and this woman is going to not have this melodrama, is going to have a very different presentation. We call it atypical, but guess what? It's typical for women. So let's not use the word atypical, because these symptoms are what women experience. This is absolutely typical for women. They may have shortness of breath, they may have fatigue, they may experience digestive problems, but they also may have some types of chest pain which may not be that pressure like an elephant on your chest. But these are symptoms that women need to understand. This awareness needs to be there. And I really congratulate you for taking that first step in India of having this Congress of prevention and really getting to the meat of the matter. How can we make a difference? How can we impact by global action? How can we start here in Mount Abu and take it to the rest of the world?
Smita, my question to you is very important and very simple. That we see that there is a huge scope of preventive cardiology. Interventional cardiology is just a small fragment of preventive cardiology.
Right.
Interventional cardiology is not a separate entity.
Yes.
It is a part of tertiary prevention.
Yes, you're right.
So if we promote primordial, primary, secondary, and tertiary heart care equally in equal proportions, I'm sure we'll be able to reduce the rising menace of coronary artery disease not only in India but in the whole globe. My question to you is, staying in the United States, how you can alliance with us to create an impact in the whole globe, how we can work together so that we create a huge movement for a healthy heart in women specifically, because I agree with you that women heart problem is underestimated, undiagnosed, and ill understood.
Yes.
And I personally feel after the age of 45 the proportion is same whether it's a man or woman. And I think if you see the expression or the exposure is given more to a man than to a woman.
Yes.
We'd like to have a viewpoints how we can work together, what are the gadgets or technologies required so that we can have a voice in the globe.
I think you raise a really valuable point. I think India and US needs to work together. I think in this digital age, we can certainly collaborate in a big way. And in fact, this generation lives on the digital media, and I think if we are into that, which you clearly are, we can make a very big impact. The other aspect is that women often are not aware of this problem. And our first step, our first big hurdle is to increase the awareness. Even in U.S., women are not aware. And the big problem that we see in the U.S. and also here is that women often think of prevention as preventing genital cancer. How can we prevent cervical cancer? How can we prevent uterine cancer? Or how can we prevent breast cancer? That gets so much impact. But for every 30 women, you have one breast cancer. But for every 3 women, you have 1 heart attack victim. So those statistics are so different, and yet women don't realize that. And there are big movements in U.S. for breast cancer awareness. We need to do more for heart disease awareness in both countries. So I'm very happy to collaborate with you on this.
Smita, I think your point is very well taken, that time has come we should talk healthy heart in a digital way. There's no doubt about it. I think that's the future. And I personally feel we must create various apps, like a smart heart app for women. When you talk of smart heart app for women, I'm sure there's going to be automatically a lot of awareness. We can create various ingredients or components of this app. The whole education today in the world is app-based. What's your idea about it?
I love the idea. I think that's the way to go. I think all our outreach efforts should be digital. The app is a very attractive modality, especially if it can be for the smartphones. I think most women are into technology. That's the way to reach them, and that can be a continuous motivation for them. It can be an app that can motivate them to exercise, to walk, to do the screening, and to be aware of the presentation and symptoms. So definitely it's the way to go.
Thank you, Smita. I think it was very nice talking to Sumita Choudhary from United States. She's very vivid in her statement that time has come. Indo-US collaboration is a must for a healthy heart in a digital way. Smita was very clear that time has come. We need to focus on healthy heart for women and not talking of cancer all the time. And she also mentioned we have to have a paradigm shift from illness to wellness. We talk of a healthy heart for women in a big way, an app application. It is the app which will create a huge educational aura in the women's mind. In the years to come, Smita will be very happy to collaborate with you so that we create healthy heart in a digital way. Ladies and gentlemen, you just heard Sumita Choudhary gave a very nice viewpoint as to how we can enhance the healthy heart in women, not only in India but also in the globe. We have with us RAI Ekanayaka, RAI Ekanayaka, who is the president of a very powerful organization from Sri Lanka, Sri Lanka Heart Association. I am very happy that RAI Ekanayaka accepted our invitation, coming all the way from European Society of Cardiology. He has not gone back to Sri Lanka. We are very grateful to you, sir.
Thank you.
And we really welcome you to India. Is it your first visit or a second visit?
This is the 3rd visit.
Oh, 3rd visit. So he knows India much more than what I know. It's very nice of you. And I'm sure since you know India so well, we'd like to have your opinion on this conference in particular. Because I'm sure this conference is a little different than our usual conferences, what I do in Cardiologist Society of India. This is a conference having a mingle of spirituality and science. We'd like to have your opinion on this. And number 2, I will also like to ask you, what is the vision of Sri Lanka Heart Association to create a vision document or a mission document of an alliance of Sri Lanka Heart Association with the Indian Heart Association, how we can work together to create a healthy heart.
First of all, Dr. Chopra, the pleasure is entirely mine. And I am very much honored to be invited to this World Congress, and which we have enjoyed the past 2 days very much, because it gives an extra dimension to the usual congresses that we have. You see, our theme this time is environment of the heart. But when we say environment, I would like to emphasize that we are not thinking of the physical environment alone. Claude Bernard taught us of the milieu interior. And as physicians, we are thinking of the milieu interior. We are changing our biochemistry. We are treating with drugs to change our biochemistry and the internal milieu and the pathophysiology to control our diseases. But what about the physical environment? Air pollution is now known to cause atherosclerosis. What about the intellectual emotive environment? This is also an environment in which we live. So I love your Congress because the vision that you have shown us is not only that we should think of the pathophysiological environment of the body, but that we are holistic beings with a spiritual, intellectual, emotive and physical bodies. And we as physicians should address this problem. Otherwise, we end up with what we call the diseases of industrialization and urbanization. And the pan-epidemic that we see now of non-communicable diseases in the world is because we have concentrated on the physical world to the detriment of our health, because we have forgotten that we have other aspects in our existence and being.
I think it's very nice, Ekanayaka has mentioned that when we talk of pollution, we talk of only environmental pollution related external to our body. What he's mentioning, that it is not only environmental physical pollution outside us. He used a very nice word, that we talk of emotional pollution. Toxic emotions, toxic behavior, toxic relationship and toxic consumption makes it toxic being. Very important statement Ekanayaka mentioned. And I think a time has come, we need to have a paradigm shift from toxicity to purity. And I think the purity is possible when we have a complete balance of the internal environment, what we call as microcosm, and the external environment, what we call as macrocosm. Ekanayaka was very particular and very emphatic that when we talk of environment, it has to be environment within us and environment outside us, and a balance has to be created at the level of consciousness. It should not be only intellect, it should not be only mind, it should not be only physical. Till we have a complete equilibrium of all these components, we cannot have a healthy heart. Very nice expression, sir. And I'm sure this conference like this, if we create on a larger scale, we may be able to achieve. That's what our feeling is. But it's all in the hand of God, because we all have to understand the heart health is not only an organ health, but it has got a strong connectivity with the whole system.
What I would suggest to you, sir, is that we should introduce into the medical curriculum. It is the curriculum that has failed us when it comes to holistic care, because we treat and we have no subject in our medical schools, at least I do not know about India, where the body-mind medicine aspect is emphasized. I know in Harvard, I don't know whether elsewhere, that Benson Starr was the first chair in body-mind medicine, the first chair that was endowed as a professorship to teach this subject, that we are no longer machines, as Descartes said, but we are actually an interaction between all the aspects of our existence.
I think a very nice expression. I think there is already a chair created now in the Harvard by the name of mind-body chair, which is existing, and a lot of things are happening in the United States. I know of Dr. Chopra, who gave a very fantastic talk in the Harvard only on mind-body medicine, because there is a very strong relationship. Sumita, I'm sure you are there in USA for a long time, and you know everything about what is happening there. What do you think is the scope of mind-body intervention for the healthy heart? Is there a scope or there is no scope?
Well, I spent nearly a decade training at Harvard, and I did my master's in public health from Harvard, and I've interacted personally with Dr. Herb Benson. I think it is a valuable component of our training at Harvard, as you pointed out, and I think it really should be emphasized in the curriculum here. I totally second your suggestion, and there is such a huge link, and now we are finding out about pointing back to the disease in women, the stress that women face in India is tremendous. You know, they have to basically be superwomen here. If they're having a career, then they have to take care of their families, their in-laws, the extended families. All the family values that we cherish put a tremendous stress on the women's mind. So definitely we are seeing the brunt of that by the heart disease that's a tsunami in the women in India. And so it definitely needs to be addressed in a very high level. And it should infiltrate down to all the providers in all the different villages that this is a very important connection. The mind-body connection is paramount.
I think Smita and RAI Ekanayaka are very, very clear that we are not the packages of flesh and bone physically with the wisps of desire in our mind all the time, but we are all the web of information and energy interwoven with the emotions and intelligence from the level of the consciousness which has an influence in the heart. So a healthy heart cannot be created just by putting in a stent in a small tiny artery. We have miles and miles of the arteries in our body. How many stents will put? We have to think that we have to do an angioplasty of so many vessels, tiny vessels, micro vessels in the brain, and then the middle-sized vessels, and then the large vessels, and then the largest vessel like aorta, where we also think of putting up a stent. I think the answer is we should think of a method, a spiritual intervention, so that we create a spiritual angioplasty right from the head to the toe, at least till the age of 80. After 80, we all have to go. We are not permanent here. We are not immortal. We are all mortal. But we should not die at the age of 40 when a person is getting a heart attack or a brain attack or a leg attack. So I think these are very, very important. I think, Ekanayaka, I'd like to ask you, what your Heart Association in Sri Lanka has a vision to go ahead with a program like this?
Yes, we do. In fact, we have started our therapy of relaxation, and we have tried and we have got onto the doctoral programs of musicotherapy, because we find that we are a multicultural society. We are a multicultural society. The spiritual aspect has to be emphasized as a method of relaxation, stress relieving. And we have gone on to see third world countries. We are all having targets, and the targets are moving further and further away from us, and we are lagging behind targets. That is because the resources and the ambitions and the aspirations don't go hand in hand. We have set our targets high. That's very good. That is the way to progress. But we must be, what shall I say, have a balanced view. And that relaxation response, we have taken it to a very high level, so that even our universities have now accepted a doctoral study that was done and was awarded the PhD in musicotherapy. And I think that is one way to do it. One way to do it. The spiritual aspect as well as the emotive and the relaxation response should go hand in hand, and the Sri Lanka Heart Association has actually emphasized this matter, not only in holistic medicine, but also in social medicine as well.
I think it's very important. Ekanayaka mentioned very clearly that what we talk of a mind-body medicine is not an alternative medicine. It's a complementary medicine. It should be complemented with the allopathy if we really want to have a better outcome. And the same thing has been expressed by Smita. I think a time has come we should talk of spirituality and science together if we really want to have a healthy heart. And I remember the insight of both the speakers here, that we should understand that we are all spiritual beings with a very occasional physical experience, and not physical beings with the occasional spiritual experience. If we understand this, life is worth living and beautiful. According to me, the hell is here and the heaven is also here. We should use our intellect to have perfect choices to have a healthy heart. I am very grateful to you, Dr. Ekanayaka, coming all the way from Sri Lanka Heart Association and giving your words of wisdom. In the same way, Smita, I am very grateful to you for expressing your insight about the women care and the woman's heart. And I'm sure in the years to come, we all will work together to create a global impact. Thank you very much once again.
Thank you.